sir. It's an extraordinary thing to be lectured by the Premier, the man who closed the repat, about services for South Australians when it comes to our health system. It's an extraordinary thing to be lectured by the Premier, the man who defended transforming health as the Health Minister. It's an extraordinary thing to be lectured by the Premier who appointed the architect of transforming health, who as an advisor in John Hill's office, as an Assistant Minister for Health, whose record on the history of South Australia's health system is very tarnished to start with, as the Minister for Health in this place to serve the people of South Australia, to deliver what was, prior to the election, Labor's #1 priority for the people of South Australia, to fix ramping here in South Australia. And if the Minister for Health has no confidence in his ability to fix ramping in South Australia, as he has made it very clear all week that he has no confidence of that nature, why should anyone in this House have confidence in his ability to do so? The fact is, they have changed the metric by which people of South Australia are expected to judge this government. We saw last Friday the CEO of SA Health, Dr Robin Lawrence, not once, not 2 times, but 3 times in the Budget and Finance Committee, being asked what was the promise that she was being tasked with delivering for the people of South Australia. What was the mandate that the government had? She said, straight after her opening statement, I have a clear mandate to reduce ramping and improve access to care for patients. She said just minutes later, we have an ongoing piece of work to improve the ramping situation. Certainly the initial target as we move forward is to reach the levels that we saw back in 2018, and I think we would all like to see ramping minimised even beyond that. She was asked what was the clear commitment. She said, I think the commitment is to return to our 2018 levels of transfer of care in 3 years. That was on Friday, sir. In Saturday, we had the then acting Premier, the Deputy Premier, go out in front media, giving the government their 1-year report card on how they were going on their election promises. She gave them 48%. She gave them 48% of election promises delivered. It was notable in the press release, no mention of ramping. Everyone before the election knew ramping was the #1 priority. The Premier told the Advertiser, a significant journal of record in this state, what was his #1 priority? It was going to be to fix ramping in South Australia. It was fix the ramping crisis in South Australia. When asked what that meant, their chief executive tasked with fixing this issue said that was reducing the transfer of care. What did South Australians think reducing ramping meant? I reckon they meant reducing ramping. What did Labor backbenchers think reducing ramping meant? Well, the member for Elder said that the last 17 months I've been out in our community with my team listening to you about our priorities, ending ramping being the first one. She went on to say, I'm committed to this and more. That was the 17th of February last year. So the member for Newland on the 22nd of February talked about the Malinauskas Labor government will recruit more nurses, improve care and safety, reduce the burden on public hospitals. To fix ramping, sir. To fix ramping. The member for Gibson described Labor's policies as Labor's comprehensive plan to fix the ramping crisis. She went on to say they will stop on the 25th of February, stop the ramping of ambulances. So you can see it. It's here in full Technicolor on her Facebook page. The Minister for Human Services can stop gesticulating. She said a comprehensive plan to stop ramping. The Minister for Child Protection on her Facebook on the 25th of February talked about stop ramping of ambulances. The member for Badco talked about her poster waving. She said lots of honks, lots of support for Labor's strategy to stop ramping. And
Order. Member for Badco. Member for Colton.
Thousands and thousands of posters on poles in suburbs and cities, in towns and the CBD of Adelaide. The Premier saying that he had the right priorities, Labor will fix the ramping crisis. And, sir, Labor MPs told their electors when they were putting themselves forward to be elected to this House to represent their constituents, they would fix ramping. Not one of them in that said that there was an asterisk saying that it would be within 4 years, and certainly not one of them said that it was going to be judged by how long it took a Category 1 or a Category 2 ambulance to arrive. No, they said they would fix ramping. They said they would fix ramping, and every South Australian knows that that meant
Member for Hartley is warned.
The number of ambulances, hours on ramps outside hospitals waiting for their patients to be moved into hospitals receiving the care they need in the environment they are supposed to be receiving. That's what Labor's promise was, and everyone in South Australia knows it. The constituents who were told by the member for Badcoe, by the member for Gibson, by the member for Newland, by the member for Adelaide Elder, and all of the others who are being asked to support their ministers today, those members know that they told their constituents that the promise was to fix ramping. The promise was to end ramping. The promise was to get ambulances off the ramps. That's what they said. That's what South Australians believed. And for them to now come out this week, having worked out that they can't deliver that, the Health Minister clearly on Monday morning, having told his Cabinet that they were not going to be able to achieve that goal, they now expect all South Australians to believe this nonsense, that that was never the promise. They expect all South Australians to believe that they never said that. You know, there's somebody who reminded the Parliament a couple of years ago of George Orwell in 1984 when he wrote, "If all others accepted the lie which the party imposed, if all records told the same tale, then the lie passed into history and became truth." So just because people in the government plan for the next 3 years every day to repeat the rhetoric that they never promised to fix ramping, just because members of the government, the Premier is indeed asking members of his backbench to show loyalty to the Health Minister above their own constituents, that does not mean they should do so. Because each member of the Labor Party who put forward materials saying Labor would fix ramping, each member of the Labor Party who told constituents at the door that they were going to fix ramping, every single one of them has a responsibility to deliver for their constituents what they promised. And what they promised was to fix ramping. And now that they know their Health Minister has no plan to fix ramping, now they know their Health Minister is telling people that what they thought they heard, they didn't hear, that what they believed was the promise, was not the promise. So those members have a responsibility to their electors. Their responsibility to their electors is more important than their responsibility to the Premier or the Health Minister, and they have a duty, sir, to vote with the opposition to support this motion, and the Health Minister should fulfil his duty to resign from this position, which he has no confidence in himself to deliver.